Hello, everybody. I'm Professor Sharon from the Personal Finance Research Centre at the University of Bristol. My presentation today is about the family dynamics of gambling harms. It's based on research that we conducted in 2022, and the report was published in 2023. And there is a link to the full report at the end of my presentation. The research was funded by Aberdeen Financial Fairness Trust. So why did we look at the family dynamics of gambling harms? We know that family members and friends are often the unseen casualties of harmful gambling, and they experience a wide range of harms caused by somebody else's gambling. But at least in a British context, there hasn't been a huge amount of research on this important topic, although thankfully that is now changing. It's something that affects many people. It is estimated that there could be as many as 11.8 million adults and children in Britain who are negatively affected by somebody who gambles. And the risk of harm is much higher for those who live with people who are categorised as a problem gambler. Families are also really important because the success of efforts to prevent or reduce gambling harms depends on understanding the complex and dynamic forces at play within the social worlds of all of those affected. So, for example, family systems theory tells us that a family unit is a complex social system in which members interact to influence each other's behaviour. And any change in one individual within a family is likely to influence the entire system and may even lead to changes in other members. We've set out here our research questions and methods. Fundamentally, what we wanted to do was to understand better the family dynamics of gambling problems in a British context and look at the effects of gambling problems on the financial and wider well-being of family members, but also look at the support that family members would like to get. In order to do this, we conducted a rapid evidence review of the literature, but the main part of the research was 45 online in-depth interviews with people who reported experiencing negative consequences from their own gambling. So we interviewed 15 people in that category, or they'd experienced harm from somebody else's gambling, and we interviewed 30 participants in that situation. And finally, in order to talk in more detail about support needs and what people wanted in terms of support, we held 3 online workshops with people who reported negative consequences from somebody else's gambling. So let's dive in to look at some of the findings. So first of all, I think it's important to think about who did we categorise and who do individuals categorise as being family. I think among our interviewees who were affected others, there were 3 main types of relationship with the person who gambled. So firstly, they were in the close family circle. So that might be a spouse or a parent or a child. Secondly, they were on the outer edge of the family circles. So sometimes that might be a sibling or another type of blood relative or a friend. And the third type of relationship was where the relationship was estranged. So, for example, ex-partners or siblings, for example, who are estranged because of gambling harms. So to give a couple of examples, the first one is an example of a relationship where the person who gambles was in the close family circle. So Stephanie, and all of the names have been changed. Stephanie was somebody whose mum had issues with gambling, but her mum was still very much in her close family circle. One of the issues that this gave rise to for Stephanie was that she'd never talked about it really with anybody because she felt like it was going behind her mum's back. And it was a really big thing to do that, and it wasn't something she felt comfortable doing. On the other hand, Callum was somebody who was estranged from his partner, who had gambling issues in the past. So their relationship had basically broken down because of Callum's ex-partner's gambling. And he felt quite bitter about this. I felt like I ruined a couple of years of my life. It just got worse. She was always asking me for money and I was never getting that money back. So I think that just demonstrates how difficult that can be, and just what negative emotions it gives rise to. We also looked at our interview data in terms of the roles that family can play in harmful gambling. And we identified 4 key roles. Firstly, that family can sometimes be a pathway into gambling. So amongst the people who we interviewed who had gambling problems, they often talked about early memories of family members gambling or being encouraged themselves to gamble by family members. Family could also be an enabler of gambling, and sometimes that was without realizing what they were doing. So family members giving or lending money to the person who had a gambling problem or paying off gambling debt. And as I say, sometimes they didn't know that that money was for gambling. Thirdly, family could sometimes be a trigger for gambling. And cases of that were, for example, where there had been a family bereavement, which caused somebody to start gambling in a way that was harmful. And finally, family could also be a moderator of gambling, so supporting or encouraging the person who had a gambling issue to seek help, and providing kind of emotional support as well. And looking at that in a bit more detail in terms of family roles in moderating gambling harms, there were 4 key areas really. The first was emotional support, so family members or friends just being there for the person who had a gambling problem, talking and listening in a non-judgmental way and checking in to make sure they were okay. Financial management was the second area, helping to manage somebody's money on their behalf with permission to help them reduce gambling, and to keep on top of things like bills, for example. Family members could also be advocates for treatment and support, trying to encourage, sometimes through their own research, the person who gambled to get help and support. And finally, offering diversionary activities, for example, going out for coffee or suggesting going for a walk, and that type of thing to try and take people away from gambling. So I'm just going to talk briefly about the impacts of gambling problems on family well-being. Gambling harms within the family, I think there were what we saw in our interview data were 3 main areas of harm: personal relationship harms, financial harms, and emotional harms. All of these were very closely interconnected. Mental health and well-being harms as part of that. I think we know less about the physical harms experienced as a result of gambling, and that's an area where I think there's a lot more that we could be doing to understand that, both for people who gamble and for people affected by somebody else's gambling. In terms of personal relationship harms, some of the key ones were loss of closeness or intimacy, the absence of the person who gambled, which could be very problematic, particularly where there were children in a family conflict, both within the kind of family unit, but also wider family relationships, relationship breakdown in some cases, and in some cases, completely reconfigured family dynamics. I'm not going to go through the case studies that we've got here. All the names have been changed. They're people from our interviews. They are in the report. But the other harms that were very evident were the financial impact of gambling on people in the family. So having to pick up bills because the person who gambled didn't have any money to contribute, getting into debt as a result of that. And in some cases, there being questions about family assets and how they were used and shared out. All of that kind of led to really strong emotional impacts, tensions created because of somebody else's gambling, and affected others talking about, for example, being deceitful here, because I'm looking for clues for the person who gambles to see if they're still gambling. So moving on to talk about supporting affected families and friends. In terms of external support seeking, it was really rare amongst the people we interviewed who had been affected by somebody else's gambling to seek external help for themselves. Help seeking tended to focus on the person who gambled. Barriers to external help seeking, I think, will be very familiar to you as an audience. Being unaware of sources of external help, feeling that it wouldn't be relevant or useful, but also wanting to manage things within a family was quite strong. Some of the coping strategies that people who are affected by somebody else's gambling, including talking to other trusted friends or family members, where that was possible, it wasn't always. Some people simply withdrew completely from the situation, for example, if it was a sibling who had a gambling problem, and others talked about simply getting on with it. Where affected others did look for external support, it was very often online information. Again, Gillian talks about, I won't go into this in detail, but Gillian talks about wanting to manage the issues with her husband's gambling within the family, not really wanting to talk too much about others and wanting to work it out as a family. So what help and support would family and friends like where they're being affected by somebody else's gambling? Our interviews showed there were really three key areas where family members and friends who are affected would value help and support. The first was around understanding what's going on. The second, how to talk about what's going on. And the third was around accessing specialist support and advice. And very often what we heard from affected others was that they wanted help to help. They wanted help so that they could help the person who gambled to reduce both their gambling and the harms they experience from it. So in terms of understanding what's going on, the people we interviewed talked about campaigns to increase public awareness about gambling harms, hearing real life stories from people like me to help recognise the early warning signs of gambling problems, and understanding more about the behaviours and motivators around gambling. Because when people couldn't understand what was happening, it was really hard to engage with it and could be, lead to tensions and issues there. The second area was about how to talk about what's going on as somebody affected by somebody else's gambling. So there was a feeling from the people we interviewed that they wanted to see help for family members and friends to talk about gambling problems with the person who gambled, but also how to have conversations about what was going on with other family members. And knowing what they could do to help their loved one was really important. As somebody said very powerfully in one of the interviews, how do you start the conversation without it ending up in anger? And the final area was around accessing specialist support and advice. And the things that people that we interviewed talked about wanting to see or being able to do was speaking to someone outside the family to get emotional support. So that idea of it being impartial, so counselling or perhaps peer support. Practical support, such as help to protect personal finances or legal advice on access to children post-separation. And finally, there was quite a strong feeling from parents who'd experienced gambling harms usually from a partner, age-appropriate education and emotional support for children. And here we've got a parent of someone who had a gambling problem saying it's like a sense of shame. You feel like you failed as a parent. So many emotions that you go through, and being able to talk to somebody else about that, I think, was felt to be really important. So finally, just to talk about some of the recommendations that we made from the research to improve support. What we wanted to see was the inclusion of specific services for affected others in strategic commissioning plans. There is some of that starting to come through now, but I think it's been quite slow. Making sure there is no wrong door for people who seek help, including a simple way to find out information online about the range of help available. I think we want to see regularly run publicity and awareness raising public health campaigns about the impact of gambling problems on family members and friends, and having some clear and targeted messaging about the existing services that can provide the types of help and support that the people we talk to really wanted. So thank you very much for listening. Please do have a look at the report and get in touch if you'd like more information. Thank you.